92, steps down as chair of News Corporation and Fox. You can get that on page 5 of the New Telegraph. Now, election petitions should be resolved before inauguration, says Nwosu. EKIOS must declare conflict of interest ahead of polls. That's Electoral Hub. You get that on page 9, 10, and 26. Mohbad, police awaiting result after concluding autopsy. Lead singer's mom begs Nigerians to help apprehend alleged killers. You get that on page 7. Now, Tinubu to Guterres. That's the world will ignore Nigeria at its own peril. The world will ignore Nigeria at its own peril. That's from Tinubu to Guterres. Says human rights advocacy shielding criminals. Continent won't accept mineral wealth scavengers. Is the first African president to ring Nasdaq's closing bell. Assures investors of free movement of funds. Details on pages 2 and 5. Kidnappers or kidnapped core members will be released soon, according to NYSC. It's on page 4. Kano streets deserted, businesses paralyzed as curfew takes effect. It's on page 29. Soludo declares free nursery, primary, JSS education in Anambra public schools. It's on page 29. Amend Constitution. Retiring Supreme Court Justice Ogie tells National Assembly. Says justices drowning in overwhelming caseload. Federal government expresses readiness to increase number of apex court justices. It's on page 4. Tribunal affirms in Bass election, dismisses NYSC forgery petitions. LP Edoga fault verdict set for appeal. On page 2. Study carried out shows that tear gas exposure linked to reproductive health risk. That's on page 26. Chukwudi.
Yeah, thank you.
Yeah, what is it for you today?
Yes, I picked up something from the visit of the Sultan of Sokoto, Abubakar III, when he inaugurated a 10.2 kilometer Bielsa, the 10.2 kilometer Bielsa Glory driveway. He said, looking at somebody coming all the way from Sokoto to the riverine area to commission a project will seem strange to some people. But there are so many things that unite us as Nigerians which we are taking for granted. You see, when I pick up any talk about how this country can become more cohesive, I don't joke with it. Because as I said some time back, I was one of those who in the, my brother is dead now, he was in Oponkaki, I was on Kaki in those days, quite fashionable then. And then it was Independence Day. The green, white, green meant so much to us. And that reinforced plastic cup was a big deal. So listening to the Sultan today, one is gladdened by the fact that a traditional ruler of that magnitude, of that substance, is reminding us that as Nigerians we have a lot we share and we should. I had an interview with our very illustrious son from Delta State, that's Chief Clark, Kiabudo Clark, where he reminded me that at a point in time, the exchange programs between the North and the South was so important that it became the ring my bell of national development. How we were, cooperating on so many fronts and all that. So when I get to listen to anybody who mentions to us that the things that unite us were created by God, but the things that disunite us were created by human beings, it does gladden my heart, So that's good talk coming from the Sultan of Sokoto. And then we go to the president, who is telling the world, you ignore Africa, the African continent, at your peril. He's not boasting. Whether the West agrees or not, the truth is that a lot of resources are still being pulled from the so-called dark continent when we were in primary school. That was the alias, notorious alias they gave us. You know, a lot of resources are being pulled from Africa to actually make the West work. So the president is only mentioning the obvious. And it goes beyond just raw materials. We are now providing labor for many capitals in the West, in the Western world today. Is it in medicine? What aspect of life are you not going to find an African flying the flag on behalf of the continent? So the president does have a big point there. And then he mentions that Africa won't accept use of human rights advocacy to stop development anymore. And he goes on to say, we are facing the great challenge of scavengers ravaging our lands and oppressing our people on illegal mines, taking our gold and mineral wealth back to developed economies by stealth and violence. That's another great point to make. But I hope it doesn't end up as saber rattling that is going to end on a note of impotency. What are the things we can do to make the West take us more seriously? These are issues we have to take up. And it can only be done effectively if we do it together. Not one soloist from either the Horn of Africa or the sub-region of West Africa, echoing it. How are we united to pursue common purpose on behalf of Africa? Very important. I really appreciate that. Then Mohbad, the autopsy eventually has taken place. Yeah, I think this paper is reported late. I saw yesterday that the autopsy has taken place, but the result is not out yet. That matter means a lot to me. It means a lot to me. Because the kind of oppression I hear exists in the industry, their industry, is frightening. And you say, is it that somebody decided to build a college within a college? Do they have their own regime within the Nigerian law and order situation? So it's very important that Mohbad's death is actually properly investigated, not just because this young man was plucked away from earth by death, perhaps too early, but the fact that whatever we do now and are able to expose anything anyone would have could have done wrongly would act as a deterrent. The action we take would act as a deterrent.
Yeah.
In future.
Yeah, Chukwu. A good background, I must say, in this analysis. I'm interested in that of the president, which, he
Yes.
made it very clear to the world, to say, look, the world will ignore Nigeria at its own peril.
Yes.
Not just Nigeria, but Africa. And he made a point, which is also resonating, even before now, that could have led to some of the mistakes that are made by military leaders in some francophone countries by striking by themselves or taking the laws into their hands, or illegally taking over power. There's some comments that he made with regards to, people who are scavenging, across Africa, having a field day, removing mineral resources because they have the engineering capacity to do that. They have the technology to do that. And Nigeria is not an exception. Of course, we know about the Zamfara situation and other parts of this country. I can tell you for sure that many states in this country, have such persons in the forest who are doing this business that he mentioned now. But you know what? The West will not come and do it for you. That is one great thing that we need to know. There's no way. You talked about cohesiveness. So where is cohesiveness in terms of having a shared destiny as a nation? To say, look, we want to achieve this objective. Let us go all out and achieve it. And when that happens, in most cases, what happens is that when we return with excuses, for failure to be able to deliver. And for me, when deliverable is not available, then the process, the whole hug of the process taken to achieve an objective, it will come to naught. So that's what we have. Cohesiveness is the way out. And yes, Africa is very important, globally. But we're just important because we have resources. But again, over the years, knowledge, resources is no longer the issue. It's now knowledge. It's knowledge-based. And you said that
Knowledge is a
Nigeria
resource.
is providing labor across the globe in
Sure.
all sectors of life. Is it the academia? Is it the medicine? Is it the nursing? And what have you? It's all over. So, but if we are cohesive, as you pointed out, and we, in all ramifications, nobody can beat this country in anything, even in the manufacturing industry.
You can say that again.
We have so many engineers. If you see the wonders that young men are doing,
We just need the will.
Exactly. Somebody to say, look, let's get this done, and we must do it. That's what it takes. China did it in the 70s, and today, I mean, in the 70s, who was China anyways, globally, to say something from China? We don't say that. Until they say, look, man, let's come together and do something.
Gentlemen, this was the subject of our conversation on Wednesday on Good Morning Nigeria, immediately after the president delivered his address at UNGA, where he outlined the issues that you have also had the opportunity of commenting on. We said, of course, that it was going to be an ongoing conversation. No question about that, particularly the looting of the treasures and resources from Africa and the underpricing of the commodities out of the African continent. These are very critical issues.
In a master-servant relationship.
Yeah, and that has to change, along, of course, with changes that should occur in the global financial system. It was the first conference, summit that the president attended in Paris to say, let's have a conversation around the global financial system. Why is it that only the global north has control, virtually as it were, over the world in terms of the financial system? And that's why you see, for instance, at the start of a little crisis, they say, we are seizing your assets. Because those assets are in your custody and under your control. We are seizing your assets. Who seizes the assets of those who are the big boys who make trouble elsewhere around the world?
And they do the impeccable job.
Yes.
Big time. Well,
you see what I say? You see what I'm laughing? What I'm laughing is, the other time, we had China, Russia, Brazil, Saudi Arabia came together. They came together, the BRICS and all of that. See,
Africa,
but why I'm laughing is this. What you are seeing today, dollarized world, has been planned over 50 years ago. So where you can't uproot it. It will take you another 50 years to do that. Because it's like Kingsley said, it is cemented into the world financial system. See, to dislodge it, will mean,
it would take greater economic power. I mean, the gold standard collapsed or was overridden by Nixon.
Yes.
By Nixon. Very quickly, I think that there's not much information disclosed in the stories. You recall when we said that the FCTA was publishing notices requiring landowners and allottees to pay up their ground rent within 2 weeks, ground rent. Now, the reports in the leadership is saying, well, landowners or allottees have been storming ages. We said there was going to be a stampede to pay, and they have collected about 1.9 billion. That's one leg. Ground rent. That's, as you say in law, is one of the covenants running with the land. Now, the other story about the revocation of land titles in Abuja, some of the names have been mentioned. So Wike, this is the son, revokes Obi, Boa, Nikitobi, others Abuja lands in different locations. They say, but what they are saying at page 27 is that failure to develop the land. That is why the FCTA, of course, is carrying out the orders of the minister to revoke the allocation. Just one caution, because I said we need more facts. When you see a name like this, the name that is on the C of O may not now be the holder of the interest in that land. Because the person may have, the original allottee in whose name the CFO was, he may have transferred his interest by way of assignment or mortgage or otherwise. So that the name, if Justice Nikitobi was a justice of the Supreme Court, erudite justice, is late now. One or two other names are also mentioned who are deceased. So they may have transferred their interest to a third party, and the FCTA under ages, through ages, will not issue a second C of O to you. So what you have will be an irrevocable power that you can then use for development or transferring your own legal and equitable. Sorry, that's too much law. Yes.
Yeah. Okay, gentlemen. Too much law and explanations. Whatever it is, we'll stop you here for today. Chukwu, thank you indeed.
Thank you,
for being here. Yeah, we'll see you again on Monday.
Thank God it's Friday.
Yeah, we'll see you again on Monday. You're watching Good Morning Morning Nigeria, only on NTA Network Service. We're going to take a break now. When we come back, we'll have to concentrate on our major topic this morning, which has to do with relevant vaccine to prevent the disease known as cervical cancer. Stay with us. All right, and to set the stage for our discussion on rollout of cervical cancer vaccine, let's now take this background report put together by correspondent Emeka Ndule, or Ekene Ndule.
An estimated 36 million women aged 15 years and above are said to be at risk of developing cervical cancer in Nigeria. Reports from the Nigerian Institute of Medical Research shows that 12,000 cases are diagnosed annually, resulting to 8,000 deaths every year, an equivalent of 33 new cervical cases and 22 deaths daily. Medical experts say this form of cancer, also known as cancer of the cervix, is the fourth most common cancer among women globally. In fact, it is one of the leading causes of cancer deaths in women in 36 countries, including Nigeria. The good news, however, is that this disease can be prevented, and the Nigerian government has disclosed plans to introduce life-saving human papillomavirus vaccines, HPV, to protect teenage girls against cervical cancer and other related diseases. The National Primary Healthcare Development Agency has already slated a date for rollout of the HPV vaccines for girls between the ages of 9 and 15 years. Data from the World Health Organization shows that the HPV types 16 and 18 cause at least 70% of cervical cancers and precancerous injuries. They are estimating that this disease could be the first cancer to be eliminated if 90% of girls are vaccinated against HPV, 70% of women are screened, and 90% of women with the disease receive treatment. But to achieve this, a high level of awareness has to be achieved, especially in rural communities. What plans has the government made to ensure a successful vaccination campaign? How prepared is the National Primary Healthcare Development Agency to cover the target population? On this episode of Good Morning Nigeria, guests shall be speaking on issues around the rollout of cervical cancer vaccine.
All right, thank you very much, Ekene Ndule, for that backgrounder. With us in the studios, and of course joining us also from remote locations, would like to welcome here first Dr. Bassey Okposen. He's the Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Dr. Okposen, regular face on Good Morning Nigeria. Glad to see you again.
Good morning, Kingsley. Good morning, Nigerians.
All right, okay. Also here with us in the studios is Dr. Sheikh Kabir. His health manager immunization at the UNICEF country office. Dr. Sheikh Kabir, we're glad to have you this morning.
Good morning, Kingsley. Good morning, Nigeria.
Okay.
All right, and via Zoom from Duse in Jigawa State is Dr. Kabir Ibrahim Aliyu, Executive Secretary, Jigawa State Primary Healthcare Development Agency. We thank you, Dr. Ali, for joining us this morning on this show.
Thank you very much. I'm happy to be with you. Thank you. Good morning, Nigerians.
Yeah, well, we're also expecting to have Dr. Njoku Moses. He's a senior research fellow, human virology, working with the Department of Human Virology, Microbiology and Biotechnology, National Institute for Pharmaceutical Research and Development. Well, when we get the connection right, he may be joining us for this conversation.
All right, so gentlemen, let's begin the conversation by situating exactly what we are going to have to deal with in terms of vaccination against cervical cancer. Why now, Dr. Okposan?
Why now? So many reasons, Kingsley. Now, we have human papillomavirus infection as the most commonest cause of sexually transmitted infections. Statistics shows us that about 95% of adults at one point or the other have been infected with it. The problem is that most times people will not know they've been infected with it. It's in a few instances it graduates to the other complications we'll talk about. We also know very well that we lose our women every year to cervical cancer. Statistics shows that about 74,417 cases of cancers are being diagnosed at our tertiary institutions. Out of these, 12,075 are cervical cancer alone. And out of this figure, 80% of them, about 8,076, die every year. These are our sisters, these are our mothers, these are our women that would have contributed to the family and the society, the economy at large. Unfortunately, these women are not supposed to die because we have vaccines that can prevent against this infection. It's shown that if somebody is infected with the virus, the chances are that it can cause cancer of the cervix, the vulva, the other genital parts, penile cancer in men. It can cause oropharyngeal cancers at the base of the tongue and throat in both men and female. It can cause anal cancer. It can cause so many other things. And then 95% of cervical cancer from research is caused by human papillomavirus infection. 95%, which means almost all the cases of cervical cancer is caused by this infection. We have a vaccine that is very, very effective, safe and effective against this. So if we use the vaccine in Nigeria, our women will not die. The over 8,076 that die every year will not die. US started using the HPV vaccine since 2006. UK started using it in 2008. Now, we did not start on time because the vaccine was not available. And US that have used the vaccine, research conducted last year, April 2022, shows that there has been 88% reduction in the incidence and severity and mortality from cervical and HPV infection. So, as a country, we appreciate the President, the Minister, the Executive Director, MPHD, and all our partners for the effort they made to get this vaccine available for use in Nigeria this time around. And this is a good thing that is happening to the country.
Yes, you know, I believe that one my colleague, asked you why now, is because it ought to have been there before now. And when you talk about the acquisition of a relevant vaccine of that nature, I mean, we ought to have given it a push, a better push, that could have, before now, made it possible for us to have this. Knowing full well that this disease is very pervasive and is deadly. From the figures you mentioned, many people would not believe that, look, that we have this knowledge and we relax all this while. Because this vaccine is available globally. It's just a question of having the will to say, look, let it come to Nigeria. I don't know whether there are other, inhibitions along the line of ensuring we will get it. So what happened all this while? Why did we relax when we know that this vaccine came on board in 2006 globally and is not lacking in terms of supply? There's no supply issues that's there. So what was it, sir?
Most times, number is a strength. But here, for us in Nigeria, this time, the number became a disadvantage in a way. Yes, US started in 2006. The UK joined 2008. The very first African country to have been able to introduce was Rwanda in 2011. Nigeria made a lot of push to get this vaccine in. but the population, the manufacturers were saying they don't have enough for Nigeria, and that the quantity they will give to Nigeria can be used for so many other countries at the same time. So there was a lot of push. Between that 2011 and 2021, we've had, apart from the Rwanda, 10 other African countries join. South Africa was the last to join in 2021, and then Nigeria now joining. So the country was pushing, and if not the push, it wouldn't have even come now, because there were still a lot that there are other countries, smaller population, and you know these things are natural. It's like a woman that lost her family, that returned to the house, there are 5 kids with only 1 loaf. That woman would definitely not eat that night. You will want to give to.
Well, let them give us our
children.
portion. Let them give us our portion. No matter how small the portion is, we utilize it. I mean, denying us, a little portion because of our size. For me, I don't know, but if you say, okay, look, I'll give you this portion, go and manage, okay? I mean, but than saying, look, I won't give you now. Let me give to smaller countries. I didn't.
Well, Kieran, it's a good point you are making. But we also had the same thing when COVID struck. You recall? I mean, we were not the first line recipients of these vaccines. We'll talk about domestic availability later in the course of the conversation. Dr. Sheikh Kabir, I would like you to weigh in further on one of the points that Dr. Bosen raised. Because ordinarily, I'm sure if you were to take a poll on the street and ask, say, look, cervical cancer, who is affected, people will tell you it's women. But then he broke it down to talk about the infection. And ordinarily, I mean, cancer is not supposed to be infectious. I don't know. I mean, if somebody has lung cancer, he can't transmit it to a second person. I'm not an oncologist, but I just want you to explain that trend. Why the rest of society, or why the rest of humanity, other than women, should be concerned about the prevention of cervical cancer by way of vaccination.
Thank you very much, Kingsley. Dr. Basi, my colleague, has already mentioned that cervical human papilloma virus is the #1 cause. In fact, almost 95 to 100% of the cervical cancers are caused by the human papilloma virus. You rightly mentioned that not all cancers are due to infection, but there are cancers which can happen due to infection, such as the cervical cancer and other type of few other types of cancers are caused by the human papilloma virus, such as other genital cancers, anal cancers, oropharyngeal cancers, oral cancers, penile cancers. So it's not the women only who are affected by the human papilloma virus, but also male can be affected. But the burden of cervical cancer is much, much more higher among the women than men or other age group, especially the childbearing age women. And these human papilloma virus infections, though it is evident that more than 95% of the cervical cancers are caused by the human papilloma virus, but you also need to know the statistics that the 80% of the sexually active people are exposed at some point of time in their life by this virus, but not all of them develop these cancers. Most of the infections remain silent, and I mean around 90% of the infections remain silent. Only few of the infections progress to the cancer, but not immediately. Over a period of 20 years, this infection turns to a cancerous status. And the cancer is only detected and manifested when it is already in the advanced stage, because it is the cervix. And it is neglected in most of the cases due to lifestyle, due to socio-cultural norms. So it is overlooked and only detected when it is very advanced stage and when there is almost nothing to do except waiting for death. And that's the way the Nigerian statistics show that on an average around 12,000 women are detected with cervical cancer, out of them, close to 8,000 are actually dying. You see the fatality of it, or if it is detected late, what can be the outcome. So that is why not only women, rather the entire population, all sects of the community needs to be concerned about preventing our women and girls and daughters from cervical cancer.
All right, Dr. Kabir Ibrahim Aliyu, Executive Secretary, Jigawa State Primary Healthcare Development Agency. I am coming over to you. Reports that we've had in the past clearly indicated that most of the reports of cervical cancer or papillomavirus are found more in Nigeria, in the northern part of Nigeria, and there are some issues raised as to why that is. I don't know what the situation is in Jigawa State, but you're going to feed us with that when I drop my question. Your namesake Kabir did point out that lifestyle is also part of the problem, because I was going to ask what really brings about papillomavirus. How does it evolve? How did it come about? Is there any lifestyle that exposes someone to cervical or to papillomavirus? I don't know whether you have done research on that, but again, as a doctor, I'm sure you have a better knowledge of this. Can you share with our viewers how much you know about this papillomavirus and how it has pervaded any part of the northern Nigeria? And again, what you are doing in Jigawa, for instance, to fight it back.
For having me, and very nice questions indeed. So with regard to the general overview of human papilloma, this presented by Dr. Batsi, but generally speaking, it's been in the literature that reasons why people come up with the disease outside of the fact that almost everybody is exposed to the virus include issues to do with having multiple sexual partners, again also engaging in sexual activity early in life, as well as inability to sort of like report the condition early. What we see in the most part of northern Nigeria is that because of the nature of the society, women usually have some hesitancy in expressing issues related to symptoms and signs of this disease that are usually expressed to their private parts and all that. So, what we usually expect is that people who have early signs, such as some discharges, and all that, they present health facilities and there's actually access to see whether there's evidence that they're actually going through precancerous condition or developing cancers. Because of the nature of the society, women are usually really a little bit reserved in terms of expressing those kind of symptoms. That's one. The other issue is that there is also lack of clear awareness on the side of the women to volunteer themselves to health facility for routine screening, even without symptoms. It is expected part of the National Cancer Control Strategy and also part of the National Human Papillomavirus and Cervical Cancer Control Strategic Development Plan for the country, that there should be routine screening of women from time to time to ensure that they really do not have this kind of condition. So there are challenges with regard to the facilities for those screening, availability of experience and expert staff that can conduct that kind of screening. That is obstetrician, gynecologists, histopathologists. We have that of those kind of human resource. Again, women usually are not mobilized enough to see the relevance of presenting themselves so that they are screened, even without signs and symptoms. So this all together come up with a situation where we have the disease only comes around when it is really in the cancerous condition and a situation where there's little that the hospital setting can really do about that. So these are the things that put off a lot of burden on the health system and actually present the scenario as having higher number of cases than it would have been because they are not detected early. And again, when they are detected, there's really not much can be done because they came really very late. So this is the reason why we put this campaign, the immunization, the vaccination exercise, really very key to ensuring that we mobilize people to understand the risk related to not going to present themselves for voluntary screening, as well as also presenting with early symptoms so that they are actually picked early enough. So I think this is just the perspective. This is the background we're working with here. Thank you.
Thank you very much, Dr. Kabir Aliyu, for the explanation that you have provided. Let's come back to the studios, Dr. Okposen. So, Nigeria is preparing to roll out the vaccines to prevent against cervical cancer. Ultimately, again, of course, human papilloma virus that could lead to cervical cancer. How is the plan for the rollout itself?
Now, based on the quantity of vaccines that is coming in, the introduction in Nigeria is faced in two approaches. The first is by states. We will have 16 states that will introduce the first phase, and then the remaining 21 by February 2024. Then the second approach of phasing will be the gender. This first phase of introduction will be for the girl child, 9 to 14. Of course, as mentioned earlier, because we have more of the cases in women, the burden in women, and we don't want our women to die. So it will go to them first. In another 3 to 5 years, with the availability of all vaccine, the boy child will also be brought on board. So in this first phase, for the 16 states, all the 6 geopolitical zones will be involved. We will have, for the Northwest, we will have Kebbi, Kano, and Jigawa implementing. For the Northeast, we will have Adamawa, Bauchi, and Taraba. North Central, we will have the FCT, Nasarawa, and Benue. Southeast, Abia and Enugu. South-South, we will have Akwa Ibom and Bayelsa. And then the Southwest, we have Lagos, Ogun, and Osun State. Now, this first set of states, the vaccine that is coming, we already engaged them, sensitize people in the states. We've sensitized all the stakeholders, both government, NGOs, CSOs, academia, professionals, traditional religious leaders, the health personnel. There's been a cascaded training. They've also been trained. All the states, up to the LGA and the health workers, have been trained. The vaccines have been deployed. Efforts are ongoing to sensitize the community members, from the girl child themselves, for them to understand the sensitization in school, engagement of the schools, for the principals, the teachers to be fully aware. We are also engaging, like in the schools, there are some debates that are ongoing. We put it as a debate for them to understand the importance of the vaccination, so that the acceptance that is when the vaccine is rolled out. And then the community members, there are also community dialogue sensitizations that are ongoing. So all this is an effort for Nigerians to know the importance of the vaccine first. Initially, in the plan, the introduction was to be on the 24th or 25th of this September. But to have a bigger buy-in and everybody properly understands what it's all about and how it is done, the launch date was extended to 24th of October to give more time for Nigerians to be told why this vaccine is important, have opportunity to be able to answer questions, concerns that anybody might have, and make sure that we have it right. Remember, in our deployment plan, like you asked, we looked into what has happened in other countries. Being the 12th African country to introduce, we had studied what other countries do, what were the strengths in their introductions, what were the weaknesses, and then we're building it into making our own introduction a success. I know initially at the beginning, some people had fear, oh, if we introduce in Nigeria, will people buy in? Of course, we know before now, our sisters, our mothers, our girl child that we've lost are things that we would have prevented. And we see people go on their own to the facilities, private facilities this time around, to go and pay for the vaccine. In the open market, we know how expensive these vaccines are with the economy. How many of our girl child can walk into a private clinic and pay 65,000 naira for the vaccine? That is what the minimum you see in a private facility.
65,000?
Yes, for one dose. And this is the vaccine that we appreciate Mr. President, the Minister, the Executive Director, Dr. Faisal, and all our partners who are supporting us to make this vaccine available, because it will be administered to our girls free of charge. And for no reason should anybody in any facility sell it. And we will encourage the public. The moment we launch, if you go to any facility and anybody asks you for any payment, we have toll-free lines, 7722, that you can call and report, because it will be made available free to our girl child.
Well, we just hope you have a mechanism, to checkmate the key actors, when the distribution starts. All right, thank you. Let's return to Dr. Sheikh Kabir, the Health Manager, Immunization, UNICEF Country Office. Earlier you told us you are from Bangladesh. Let's have the Bangladesh experience in this. If it has happened, I don't know whether your people are exposed to this kind of disease. But if it's a global phenomenon, let's share. Because for us now, it is new. This vaccine just came in, and it is just, enumerated, the planning, the strategy for its distribution, and administration, and on the girl child. So what is it like where you come from, and how best do you think they will go in terms of distributing it? He has already given us an idea of what it is. Do you think there are areas you could say something that will assist them in making sure it gets around? Let's share Bangladesh experience, if any.
Thank you very much. Yeah, it is very important for us here in Nigeria to use the lessons learned in other countries, the experience, customize our approach and strategy based on the previous experiences in other countries. Bangladesh has a similar social settings actually, as well as the population. It also has a big population which counts for the introduction, and Bangladesh is actually currently deploying the vaccines, so it is still under progress or in progress, like us here in Nigeria. But we are considering their experiences. Some of the global platforms or global conferences actually brings people together to share their experiences. So what we came to know, the sensitization of the community is number one, and engaging the stakeholders who have influences to the community is paramount for a successful deployment of these vaccines. This vaccine rollout has a complex target age group, the 9 to 14 years old girls. These girls are in the schools and outside the schools. So the school enrollment is a factor and determinants to effectively and efficiently roll out these vaccines. We wish we could get all the girls in these schools, but that's not the case. There are out-of-school girls. So the health authority has to operate and execute measures to reach out the girls who are outside the schools, and this is one of the difficult tasks actually, because this vaccine cannot be given through house-to-house vaccination campaign. It's injectable vaccines. It needs a session. It may be a temporary outreach session to be conducted in the community to administer the vaccine to the target age group, and then mobilizing those girls to the vaccination center. So it needs a tailored actually approach for supply side, like sending the vaccine, the human resources, keeping the vaccine in appropriate temperature or cold chain, then demand generation and community awareness building, and then mobilizing them through the community influencers, elders, leaders, and of course the parents. Similarly, the teachers. So it is a vaccine rollout where health is not the only actor. There are other critical actors need to be active, and fortunately the countries who have introduced the vaccines, including Nigeria currently introducing, the multi-sectoral approach is paramount actually. So engagement of education, engagement of other sectors, the civil society organizations, the religious platforms, everything are being tapped actually to build the awareness and engage them to send the messages to the communities and to the parents, and of course in parallel to address any rumors, misconceptions, misbelief about the vaccine, so that the demand is created and everybody can be given, all the 9 to 14 years old girls can be given a dose of the vaccines.
All right, thank you very much, Dr. Sheikh Kabir. Now let's return to Dr. Kabir Aliyu, who is still with us via Zoom. Dr. Aliyu, your state, Jigawa, has been chosen as one of the first states amongst 16 to get the vaccines when it is formally rolled out. Dr. Oposun here has indicated the various measures that have been taken in terms of sensitization. Share with our viewers what the experience has been like in Jigawa ahead of the rollout. What is it you've been doing?
Thank you very much once again. This is a vaccine that is really very important for us in our programming as primary health care and as people of Jigawa State. And I have realized the task ahead of us. Since July, for the last 90 days, we constituted a technical working group for the implementation of human papillomavirus vaccine. Within that group, there are representation of the technical crew, the people who really are in the forefront in provision of this service. We have the civil society that has been mentioned by Sheikh. There are people from academia, traditional institutions, religious bodies, professional organizations, and different interest groups that really key in provision of awareness to people in the hinterland. The real challenge we foresee in the implementation of the human papillomavirus vaccine in a co-northern conservative state such as ours, interpretation and misinterpretation by the local population with regards to the choice of the target population provision of this vaccine. We are dealing with people who really usually have some kind of express concern about issue to do with sort of like either it's a way of providing some kind of family planning to these kids, or we have a deliberate attempt to ensure them that certain birth rights are not potentially allowed or something like that. We realize this kind of concern because we are talking about 9 years to 14, and these are young people who are usually gathered with a lot of attention here in many parts of the northern part of the country. So because of that, we engage these layers of these professional and other stakeholders to ensure that the mobilization goes on. Like I said, for the last 90 years, we've been having meeting every 2 weeks, and each day we have specific task to provide clear statement about which each subcommittee within the technical working group shall be doing. We've had so many media engagement, we've had so many real discussion, we have phone-in programs, we've had engagement with community people at lower level and all that. We've paid serious courtesy calls and visits and advocacy visit as well to senior level policy makers, including traditional rulers, including higher government policy and authorities. But the important issue about all this is that we have a very enabling environment created by His Excellency the Governor, and the technical working group on immunization itself is chaired by the Deputy Governor himself. So the forces behind success are much, much stronger than about the challenges. In order to ensure that we are on track, we also collaborated with WHO at the state level to sample public opinion about reception and otherwise, and whatever impression people will have about this vaccine. And luckily enough, we realized that people are really eager to get these vaccines. Initially, we
We are currently having issues with Dr. there in Jigawa.
I don't know whether you can still hear me.
Yes, we can hear you now.
Yeah, go ahead, please.
Yeah. Okay, so I mean, the people, the hesitancy is not pronounced. People are really willing, and we have provided so many engagement, direct communication between us and people to give us to inquire about further information. That is with regards to mobilization. With regards to also the technical aspect, including provision of the freezing capacity, cold chain management, waste management, the plans for deployment of this vaccine, training of health workers, logistics for deploying a reverse logistic for this vaccine. These have all been taken care of. We have mobilized resources, and we are just waiting for that time to just go in and ensure that people are really protected with this vaccine. Schools have been mobilized, different layers at different levels, private school, public schools, and we also have special program for out-of-school kids who are in the market hawking. We've engaged different unions of these people who live close to these people, who roam around the street and who sell things around the roads and all that. We have special program for different layers of this, and we have already delegated, we have already assigned the points where this vaccination will be provided at different communities. And people are already being informed about where they should go to ask for these services when the time for the vaccination comes with their own community and all that. So I think all is on deck. We're really very prepared to ensure that this is really very successful. We understand the kind of resources that are invested nationally and globally to ensure that the common man is protected. We're providing and packaging this whole thing as yet another dividend of democracy to ensure that for the first time, now we can prevent cancer, and a very important cancer that kills women, and especially in our own setting where women do not have the usually do not express themselves when they have early symptoms. And that is the buy-in that we usually provide. The religious leaders are playing a significant role in ensuring that this concept has put to the last mile and ensuring that they really understand what we're talking about. Just last week, we had an engagement with the National Agency of Orientation, NOAA, and a representation from both religious groups, Islam and Christianity. And it is so amazing how people are open to accept this. In fact, they are calling that, please, can we also come? Those of us that are outside 15, can we still come and get these vaccines? So, I mean, just to let you know that Nigeria is really ready to take up this opportunity to ensure that we prevent the burden that actually berate our health facilities where women turn a large number seeking for services. We're really glad the National Primary Health Care is taking the lead in provision of these services, and UNICEF is providing the logistics support to underpin successful implementation as is desired in the plan. Thank you.
Thank you, immensely too. That's a robust plan and strategy that you have outlined. And our issue in this country has always been adequate implementation of well-articulated strategy. We wish you well, because from what you have told us this morning, it appears you have a comprehensive plan to get this delivered. We appreciate you one more time. Now, back to the studio. The issue of misbelief that you talked about, Kabir, here you talked about misconceptions. This in Jigawa that has been dealt with, based on what Dr. Kabir has told us. So let me return to you, Dr. Bass. Maybe I should have asked this question earlier on or something. But this is a conversation, I can always do a rewind. See, what causes papillo disease? How does it come? Does it originate from the body chemistry, or is it acquired? Is it by intake of liquid or eating food? Right? How does it emerge? Because if it comes from the body, it's just a matter of genealogy or something. How does it come?
In the environment, I will use the common word we know in Nigeria most times. We say germs, and you will even hear people crack jokes. James doesn't kill Africa, but meanwhile it kills and maims. When we look at the germs, there are so many things that makes up germs, those tiny microorganisms that causes disease for man and animal. Yes. Now, it can be bacteria, it can be fungal, spirochetes, viruses, and so many other groups of microorganisms that can cause disease that will affect man. The human papilloma virus is among the virus group of microorganisms that causes disease. in the environment is contaminated with these microorganisms. There are over 200 strains of human papillomavirus, but there are 9 strains that cause most disease that we find in man. We have the type 6, the 11, 16, 18, 31, 33, 45, 52, and 58. For the cervical cancer we are talking about in Nigeria, most other countries, is type 16 and 18 that are commonly involved in causing that. Now, like we mentioned earlier at the beginning of the conversation, you know, we have a group of diseases we call the sexually transmitted infections. And we had mentioned that human papillomavirus infection is the commonest amongst the sexually transmitted infections. So, if I answer your question directly, how does it come? Most commonly, its route of transmission and spread is through exposure. And that is why you see that, like Dr. Kabir, the Executive Secretary Jigawa also mentioned earlier, the fact that you see it will be most commonly amongst people that have early exposure, multiple partners, indisciplined lifestyles, and so on. And those people have chances of being infected, yes, and then infecting others. So, of course, you know, cleanliness is always very good when we maintain a certain level of hygiene, cleanliness, and so on. So, it's when somebody is now exposed, becomes infected, it can also spread to others. And the statistics have shown very clearly from the NBA statistics, the multiple indicator cluster survey, National Immunization Cluster Survey combined, the 2021, shows very clearly that 19% of our girl child become exposed at age 15 to having sex, and that is not too good. And of course, remember, early exposure exposes them to having this infection, and that is one main reason why in the timing we want to reach out to the girl child 9 to 14 before they are exposed. And since we know that the vaccine, once it's administered, it prevents the person against being infected with the virus. And once the person is protected, the chances of now having the disease and complications are also prevented. So that is the general picture of how it comes.
Okay, very quickly, Dr. Bosen, you said there are 9 strains of the HPV that are most virulent, if I use that word. But then you then mentioned concerns about type whatever. I can't remember those exact figures now, but that's your field. What does the vaccine protect against? Is it against these 9 virulent strains of the HPV, or what? What does the vaccine protect against?
Now, in Nigeria, we are using, with appreciation once again to His Excellency the President, the Honorable Minister of Health, the ED, and the partners for the support. We are getting the best for our girl child, Gardasil. Now, you know, Gardasil, 92% of vaccination in US is Gardasil. 61% of vaccination in the UK is Gardasil. Even the Asia that has so many companies, studies have shown that 51% of the usage is also Gardasil. The country team, with the support we've had from government, was to get the best for our girl child, the Gardasil 4. So it has that potential. We have the 16 and 18 as the commoner causes of the cervical cancer in Nigeria. The 16 and 18 is part of the component.
Type 16 and type 18?
Yes, that is included there. 6, 11, 16, and 18. And this is what communist studies that is conducted in Nigeria that shows the genital wart is also. So all the strains that causes most problems in Nigeria, where we have also seen from our studies, are contained in the Gardasil. And that makes it the best for us. And of course, it's like somebody, you know, wants to buy a car. He's a young man and he said, I'm not going for Beetles. I want to buy Mercedes E-Class. He will save and save and save until he gets that class what he wants. The country did not rush into using any type of vaccine that is available. And this is a kind of reassurance to Nigerians that what the government is bringing in is the best for the country that will protect against most available strains in the country.
All right. As a matter of fact, the way you are, classifying, the particular one you have is a clear indication to me, that the possibility of even dreaming of manufacturing such vaccine in Africa is not there yet. Yes, because of course we know what it is, the complex nature of vaccine manufacturing. All right, thank you, gentlemen, for this outing. We still need but want to appreciate you for your contribution so far. You're watching Good Morning Nigeria, only on NTA Network Service. We will take a break now, and when we come back, definitely the conversation continues. Stay with us.
Yeah, welcome back, and you're still watching Good Morning Nigeria on the network service of the Nigerian Television Authority. Let's come back to Dr. Sheikh Kabir. What is the role of UNICEF in the rollout of the HPV vaccine?
Thank you very much, Kingsley, once again. UNICEF is the technical agency providing the technical supports at the national and state and below level for planning and operationalizing the different aspects of the rollouts, particularly focusing the vaccine supply, vaccine management, cold chain management, and information, education, and communication aspects of the rollout. UNICEF is also assisting the National Primary Healthcare Development Agency and states in training and capacity building of the health networks and other stakeholders engaged so that the different technical aspects of the rollout, the health workers are well aware of it and can follow those protocols and SOPs, etc.
Are you satisfied with the lead up to the rollout?
Well, we are still having few more weeks before the rollout. The preparations are still ongoing and strengthened, and the states are at different stage of readiness. So before 24th of October, we are optimistic that the readiness will be appropriate and sufficient for the rollout. So it's progressing, and it's progressing well, I would rather say.
Are you having a better collaboration or partnership with the states in Nigeria that are involved in this?
Definitely, as I said. That,
or are there hitches or glitches here and there in terms of the planning?
Well, this is part of a program actually. So different states has different capacities actually.
Okay.
So bringing all of them together with the same page and same pace is critically important.
All right. We're coming back to you in Jigawa, Dr. Kabir Aliyu. Now, rule out. Let's get to know, when is it going to start, or has this already started? If it has, what's your assessment? If it doesn't, if it has not, when are you starting? I want to hear from you whether you have injected the first or the second girl child in Jigawa State, to let us know when it's going to start, and then how prepared are you? Because from what you have told us earlier on, it appears that you have sensitized the communities in Jigawa State, and there could be a rush, so to speak, because if people are aware, of the necessity for that, they will come out in numbers. How do you intend to control the person that will show interest? Because I know that what you have may not be adequate in terms of reaching out to those that may need it.
Yeah, thank you very much once again. The target for this age group, 9 to 15 years in Jigawa State, is slightly less than 700,000. So it's not a big number. We're coming out from a campaign where we vaccinated nearly 7 million people during the yellow fever campaign that we had. So for us, this is like, in terms of the target, it's not a huge number that we should be worried so much about. With regards to implementation, the implementation date for Jigawa is the 25th of October. So we still have pretty 1 month ahead before the implementation really takes off. But like you said, we're not taking anything for granted. We're going further down to ensure that the right target are the actually ones that are mobilized during the vaccination exercise. Part of the researches we are also doing was to provide a platform where there is a flag up and it to be demonstrated the age group during the flag up, and we demonstrate also by vaccinating prominent people, kids, so that people really understand and believe that this is a safe vaccine. We've been emphasizing over and over, this is a very safe and effective vaccine. It gives more than 90% protection in the development of cervical cancer. It's an opportunity that no one is going to miss, will afford to miss this kind of opportunity. So before the implementation, the technical working group is still meeting every fortnight, taking inventory about the must-do list that have been provided, ensuring that people really tick their boxes. This includes mobilization of counterpart funding from local resources, from the local government and from the state caucus. It also includes ensuring that all the items, especially the data monitoring tools for the implementation, are on ground, and also pre-testing the entire system so that we really track the deployment of the vaccine with minimum wastage as far as the implementation is concerned. We pretty understand how expensive this vaccine is. This is something that we always see on films, that, you know, during Nollywood, you see somebody being prevented for cervical cancer. For the first time, this is coming to the country, and the first dose is yet to be shot in Jigawa State and in many parts of the northern part of the country. But we look forward to ensuring that this is really very successful. We are all ready to ensuring that the flag of time, the 25th October, if we are lucky, NTA will be provided with that kind of information at local level here in Jigawa to give us the coverage that we so require. And we all together will celebrate this success together. Thank you.
Let me remain with you. What about the administration of this vaccine? I'm sure you already have a well-trained personnel that will do that. Of course, it's a new vaccine to Nigerians, and of course, new to also the medical personnel in Nigeria who have not administered such vaccine before. Is there any kind of special training as is required for the administration of these vaccines?
For traditional vaccines, each time we are going to have some kind of campaign of this nature, we have to retrain people. The training includes, first of all, the vaccine, how it's presented, how it's mixed up for those that come with different powder and solution, that kind of thing. The training also includes the dose. It also includes the method of administration, the type of part, the body part which this vaccine is going to be given to people. We also train people to identify side effects, if there should be any of those kind of adverse effects following immunization. Is part of the training. The training also includes logistic movement. How do you move from one point to the next point? And who does that movement? Where your daily implementation plan? Which team moves on day 1 and day 2 and day 3 and so on? So training is, the state level training is already started. We've already had an NTOT at the national where people were engaged to provide some clear directives about how this is going to be done across the country. So we are segregating this further from the local government, from the state to the local government, from the local government teams down to the ward level teams that will provide in the last mile, and then down to the vaccination teams. There are technical people that are provided with clear information about technical vaccination. And then there are the support portion of the teams that provide issue to do with card control, record keeping, movement of vaccines and all those kind of things. So this whole training is packaged under what we call the training plan, and it's already been delivered time by time. We have a dashboard that these are actually tagged in terms of which day, which state is going to do what. And then the national is tracking the performance of the state across these dashboards, including training plan, logistic plan, team movement plan, and all those kind of plans that we do in vaccination of this nature, including also demand creation and health promotion plan and all that. So the training has commenced at the national, and like I said, between now and the next 4 weeks, we're going to the last mile, the last vaccinator who is going to touch the vial. that kind of training provided to them, as well as also the social mobilizers that are working around the team members who move from community to community.
All right, Dr. Aliyu, thank you very much. I'm tempted to come to Dr. Okposan, but I know we're running out of time for this very interesting conversation. I want to ask you this question, arising in part from the observation made by the UNICEF officer who is here with us in the studio, Dr. Sheikh Kabir, in terms of what is said with respect to not all the states have equal level of preparedness. I was just going to ask you, the various state primary healthcare development agencies, do they have a common meeting point, an association or a union, or some platform where they can share experiences and let one learn from the other and so on and so forth? Do you have that kind of gathering? Very quickly. Dr. Kabir, it looks like it's when I wanted to get the response from you that we had a freeze. But assuming you heard my question, I want to repeat it. Is there a platform, a common platform for all state primary healthcare development agencies where you can share experiences? Now, ahead of this rollout, to say, oh, this is what I'm doing in my state, another state will tell you this is what we are doing, and then you learn from one another and reduce maybe the differences in levels of preparation as well as effectiveness of your activities. Can you hear me?
Yeah, well, absolutely. We have a common platform that we meet at WhatsApp, but that's just a general one where all the ESCs meet to discuss areas of common interest. However, for the implementation of human papillomavirus vaccination, this is yet to be elaborated. But I think this is an idea that's coming up in this discourse. We can look at the possibility of creating such kind of platforms so that we can share experiences, concern, and best practices so that this whole together is successful countrywide. Thank you for providing that kind of reminder for all of us.
Thank you very much, Dr. Aliyu. No problem. I appreciate what you have just said. We will send our invoice to you for the consultancy. All right. So back to the studios here, Dr. Okposan. Dr. Okposan, let our viewers know, and even for us here in the studios, how many doses of vaccines are we rolling out now? Maybe in terms of millions in the 16 states. That's one. And what is the effectiveness? Does it give lifelong protection? How many doses do you need? You know, the reserve immunization, you go for one, I don't know. I know the various stages. Is this a one shot and then you are covered for life, or what? And how many vials are available for this rollout?
Okay, thank you for the question. I think for the particular vaccine we are going to use, Gardasil 4, is single dose. The girl child will only be given one dose, and studies have shown very clearly is very safe and effective. And of course, it's not like some of the earlier ones that used to come out, used to be 3 doses. At the point, it was 2 doses. There are still some that are 2 doses, but the Gardasil 4, one shot is enough to protect the girl child. So that's one advantage we are going to have, so that once the girl child is vaccinated, she doesn't need to come back immediately for the second dose like it's in other vaccine. That on its own saves time, saves the logistics, saves the operational cost of bringing a second time. So the vaccine is very safe and just a single dose. And then also to mention, I know for our states that are involved in the introduction, the very first entry point was to bring in all of them for central training. And then there is a weekly technical working group that all the technical working groups of the states that are implementing join in, where we share the dashboard every Tuesday, 2 p.m., where all of us sees where we are on the dashboard. We ask questions. Both the technical working group staff that are there at the state, our partners, donors, they join as far as from Gavi headquarters in Geneva also, where we ask questions and share experiences from what happens. That happens every Tuesday by 2 o'clock. And then internally, back here, the partners donors now meet more than once in a week to review what goes on.
Okay,
so we are all on the same page trying to see what we can do to get the best for
Okay, so let's talk about the efficacious level of this vaccine. What is the guarantee? What is the period of time? And after taking the one dose you talked about, how long will it take her, will it prevent such an infection in her? Is there need to return maybe after 3 or 4 or 5 years as the case may be? Or is there an age when you could say, look, you can take care of yourself, you don't need vaccine anymore? So the efficacy of the vaccine. And again, the chemical component of this vaccine we're talking about, has it been dissected, by those who should? Or at least in Nigeria, NAFDAC, I think, does that, to even know what is in there. I mean, they're going to admit and say, yes, it's one of the best across the globe, but we'll do our own local investigation and stuff, so that you can say, look, I'm confident that this is the real thing.
Yeah, the vaccine we are using, Gardasil, our NAFDAC has looked at it and certified it. In fact, it's one of the vaccines that stayed longer with them for the full analysis. And so the vaccine we are using have been passed by our own NAFDAC. When you look at the components that are there that people might be worried about, the preservative is yeast, the common yeast we use for bread. I don't know how many Nigerians don't eat bread and other confectionaries where yeast is being used. Studies have shown is in a place like UK, some of them can react to yeast. But that is not a problem in Nigeria, because you see, yeast is one of the things we use very commonly in Nigeria to do so many things, from cakes to ching-chings to meat pie and every other thing that we are doing. So that is the preservative there that is not harmful in Nigeria. You see, the vaccine, when it's administered, just like any other thing, ordinary fish, as good as nutritious food fish is to the body, it's not every human being that eat fish. There are some people, you give them fish now, the next 30 minutes they will react to it. Fish, as good as fish is.
I know, it's true.
Water, there are some people, you drink more than half glass of water, the water that is good for the body. So the body system depends on the person and how they react to things that come to them. Generally, if the vaccine is being administered, just like any other vaccine, being an injection, even when you are taking antibiotics injection, that is to prevent an infection, you feel pains at the site. So one of the things you can see after the administration, maybe the girl child will say, oh, the place is paining her, but the pain of today is for the joy of tomorrow.
Tomorrow, that's right.
Remember in those days, the scars we are still having on our when we were giving the vaccination against the tuberculosis and the rest, it's easier to get that scar than to come and take drugs injection every day for 6 months. Some they still have to repeat and so on. So those minor conveniences that they might feel sometimes after the administration cannot be compared to the joy of tomorrow, the protection from the disease itself and other components of it. So the vaccine generally is safe. We have seen it used in other African countries. We're following up. It's very safe. We have seen the statistics from the US where 88% of the cases have a reduction. And that is the same thing we expect to see in Nigeria, just like any other one. And then for the protection level, we can see that for the vaccine that have been used and the studies that are ongoing, we've seen that they are protect over 10 years and above. And the level of immunity is still strong, even in those that were given 10 years ago, and they are being followed up. And then the vaccine
is less than 20 years in the world.
And the world. So it is, the studies have shown so far that with the 10 years and above, for healthy individuals, is achievable.
Okay.
It is when somebody is immunocompromised and the rest of it that sometimes will not be as strong as somebody that is eating well, with strong immunity, and the rest of it. But generally, the vaccine is safe and prevents against the infection.
Okay, thank you very much. I know, the reaction stuff you was discussing. People have different ways of reacting. I remember there was one vaccination we took in 1971. I mean, virtually everybody, you couldn't lift your arm. I don't know what it was, but the machine they were using looked like an AK-47. It looked like an AK-47.
Yellow fever or something.
I don't know what it was, but it was like an AK-47. After that one, you couldn't lift your. but I mean, as you said, it's kept us going. We're grateful for that. But Dr. Kabir, yes, the target group is 9 to 14, probably 15. Can those who are 15 and above also come? I mean, if people will say, this thing will protect you. If you are 18 years, go there. Go if you are 19, go there. If you are 20, and then probably different. So who should strictly be vaccinated this time around? I'm sure there will be a rollout again for perhaps for the general populace. Or I mean, can a 40-something-year-old man or woman say, I want to go for this vaccination?
Thank you, Kingsley, once again. Yeah, as you have already heard that the target age group for this vaccine deployment is 9 to 14 years girls. So the vaccine which are made available at the moment in the country is based on the calculation made for this target age group. Now, why this target age group has been selected? We have already heard that the vaccine is most effective if it is administered before the girls are coming into sexual contact, actually. And the average age of sexual contact of the girls in Nigeria, we have also heard about that. And that is why it is critically important that 9 to 14 years are administered. Now, the vaccine, if it is administered after sexual contact, and after the someone already infected with HPV, it may still works for other type of cancer caused by the HPV. But our objective is to protect our daughters, our girls, against the cervical cancer caused by the human papilloma virus, and that is why it should be taken by them, it should be given to them who are not yet infected or who are most likely not yet active in the sexual contact.
Just like any other vaccine, that vaccine is not curative. It's just preventive, isn't it? It's not curative. But is there any treatment for cervical cancer, any form of treatment at all available globally?
Thank you. Like all other cancers, it is very difficult
to treat. Okay, all right. Thank you.
Especially when it is detected at the advanced stage.
Okay.
It is even more challenging and more costly. And that's why the fatality rate or number of deaths from this cancer is very high.
All right. Dr. Sheikh Humayun Kabir, the health manager, immunization, UNICEF country office, we thank you for coming. I was wondering, maybe Dr. Bassey was itching to say something.
I wanted to add that, for the age group 9 to 14, now they are a priority. In advanced countries where they have
plenty of
the vaccine, up to age 26,
can have it.
That's importantly, the message we want to add to Nigerians: when you attend at 26 and above, in this cancer control strategy, elimination strategy for Nigeria, the woman should always go for screening every year from 26. Because once you go for pap smear, the physician will guide and you are screened. If for any reason the woman is having early precancerous sign, it will be picked, and at that point it can be easily handled, treated, and it goes without complication. Remember,
right.
the statistics show that 80% of the cases come in at advanced stages because they were not. So we advise our elderly
To go
women
for checkups,
to go for
right?
screening on an
Dr.
annual basis.
Okbosen, Basio Okbosen, we're running out of time. We thank you. You've already given us vital information on this very subject matter. Dr. Okbosen is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency here in Abuja. I'd want, of course, appreciated Dr. Sheikh Kabir of UNICEF. And now let's appreciate Dr. Kabir Ibrahim Aliyu, the Executive Secretary, Jigawa State Primary Healthcare Development Agency. We thank you also for feeding us with a lot of information regarding your preparedness for this rollout. All right, now we're back to the studio. And
yeah, that's we have to call it a day. It's been a very interesting conversation. We hope you also enjoyed the conversation on the rollout of the HPV vaccine in Nigeria. Join us on Monday, same time, 7 o'clock for a fresh edition of Good Morning Nigeria. Until then, enjoy your weekend, but look after yourselves. I'm Kingsley Osadolo.
And I'm Kieran Umayo. Do have a wonderful weekend.